I'm Dr. Pat Mallory. Welcome to the practice. I'd like to take a few minutes to talk to you about regenerative injection techniques, what we call RIT. These are 3 different injection techniques that we use to treat ligaments and joints in patients who have chronic pain from ligament or tendon injuries or joint injuries that could even just be plain old arthritis. Regenerative medicine is a type of medicine that seeks to promote natural healing within the body. In other words, techniques that try to get the body to heal something that it has not been able to heal on its own. In the case of a joint that's painful because of arthritis or possibly because of damage to a ligament or a tendon that might attach in and around that joint, there are 3 different types of injection techniques that we offer that are all part of regenerative medicine. Those include prolotherapy, PRP injections, and PRP stands for platelet-rich plasma, and then stem cell injections. And in that order, they kind of go from less intense to more intense therapy. Stem cell injections involve injecting stem cells to promote healing in a damaged area of the body. Stem cells are cells that exist in the body specifically to heal damaged tissue. They are capable of growing into new tissue. And so the stem cells that we inject when we do these stem cells injections have been collected from fat. So in other words, if I need to do a stem cell injection on a patient, I would have them in and we would extract some fat from their body, typically from the stomach, although we can take fat from anywhere else. The amount of fat that we need for a stem cell injection is 60 milliliters, which is actually only 4 tablespoons of fat. It doesn't take very much. From that amount of fat, we can actually extract 50 million stem cells, which is pretty amazing. The stem cells then are combined with PRP, again that's platelet-rich plasma, and that combination then is injected into the joint or the ligament or tendon or whatever it is that we're treating. And so when we inject this combination of stem cells and PRP, the stem cells seek out the damaged tissue and start to grow into new tissue in the area that's been damaged. And the PRP releases growth factors that basically stimulates the stem cells to do what they need to do. Well, fat it turns out it's a wonderful source for stem cells. For a number of years, stem cells have been harvested from bone marrow. And there are still quite a number of doctors out there that collect stem cells from bone marrow. Some of the drawbacks to bone marrow stem cells is that, first of all, collecting bone marrow is somewhat painful. It has to be collected from the hip at the back, and it's a painful process to go through, number 1. Number 2, there's a limit to how much bone marrow can be collected. Number 3, the stem cells aren't in very much abundance in bone marrow. And so as a result, when we collect bone marrow for the purpose of harvesting stem cells, once the stem cells are extracted, they then have to be grown up in culture in a lab. So they literally have to be sent to a lab. In some cases that's outside of the country. And then they're grown up in culture in order to develop enough stem cells to be able to successfully inject the joint or, again, whatever body part you're injecting. In the case of stem cells from fat, it turns out that fat is a very rich source for stem cells. And so, again, from that 4 tablespoon volume of fat, or 60 milliliters, we're able to extract 50 million stem cells, which is more than enough to just go right ahead and inject a joint or other structure as soon as we get those prepared. So it's a quicker procedure. We're able to do it same day, and it turns out that the stem cells are actually of a better quality even. Not all stem cells are the same, and so when the stem cell scientists have studied these stem cells, they're able to tell what proportion of the cells from bone marrow versus fat are actually active, and there's a much higher percentage of active stem cells from fat. When we harvest fat for stem cell injections, essentially what we're doing is a mini liposuction. Again, the volume of fat that we need just for stem cell is only 4 tablespoons. So if that's all that a patient really needs us to take fat for, it's a fairly quick process. We infuse anesthetic solution into the area where we're going to take the fat from. Again, that's usually from the abdomen. It takes about 20 to 30 minutes to infuse the anesthetic solution. And then it takes about that much time or less to remove that small amount of fat that we need for the stem cell injection. Recovery is very quick. That's probably actually the more painful part of the procedure. The stem cell injections themselves actually are usually not very painful at all. So if there is any discomfort from this whole process, it's more likely to be from the site where we harvested the fat. But even that is not very painful, and typically within 2 to 3 days of the outside, you go back to full activity. Don't have to place on any restrictions. Absolutely, we can take quite a bit more than that. That's a common question because most Americans have more than 4 tablespoons of excess fat. Consequently, we do offer liposculpture here. When we perform liposculpture, basically we're taking off fat and we're sculpting the body into a more natural and pleasing shape. So we can combine that with the fat harvesting if someone needs a stem cell injection but also wants liposculpture. We can do that as well. The success rate increases as you go from prolotherapy to PRP to stem cell. The success rate with stem cell approaches probably 80+%, which is really fantastic. Most surgeons can't even offer that kind of benefit. The answer to that in part depends on how far from your normal routine you are before we do the injections. Some people haven't worked for quite some time before we treat them, and so we don't expect them to get back to work right away. But yeah, if you've been working and functioning in a fairly normal capacity, we don't really expect any downtime whatsoever from these injections. Again, with the stem cell injections, primarily because of the fat harvesting, we usually do recommend that you consider being off work for 2 to 3 days. For that purpose, we usually tend to schedule those on a Thursday, which ends up being good timing because people can hopefully take Friday off and be off for the weekend, and by Monday we expect they'll be back to work. Thank you very much for taking the time to listen to our discussion on regenerative injection techniques. I hope that this was informative. If you happen to be someone or know someone who might benefit from these injection techniques, I would encourage you to consider coming in to talk to me or one of the physician assistants in the practice. We'd be very happy to see you and discuss these with you in more detail.